me a minute.
Sorry about that. I just had a very quick back where I thought my microphone had just died. I wasn't getting any bars because it was so quiet in here.
All right, good morning, Queensland. So in some good news overnight, we only have 2 new cases, and both of these are in hotel quarantine, so we're not worried about these cases. We have 26 active cases, and look, phenomenally, over the last 24 hours, we have had 20,615 tests done. So once again, congratulations to everyone who's been coming out and getting tested. And if you have any symptoms, make sure that you do that. So everything we've done in the past 6 days is because of the arrival of the highly infectious UK strain of COVID. Not much is known about it except that it is highly, highly infectious. And of course, we are learning more and more about it every single day. Now, we had some genomic testing that came back late last night, and Dr Young will go through that in more detail. But the genomic testing has now linked 6 cases of the highly infectious UK variant of COVID. These are the UK traveller and his partner, the hotel cleaner and her partner, and the man and his daughter from Lebanon, who we told you about yesterday. So all 6 have a connection to the Grand Chancellor Hotel, and at this stage we want to also say that the Grand Chancellor has not had any issues by taking COVID people since September, and they've cooperated entirely with the health authorities, but we are now concerned about this cluster. So both groups of these overseas arrivals stayed on the same floor of the hotel at different times, but not in neighbouring rooms. So there is no need for the public to be concerned, but we are going to take some immediate actions as a precaution. And Dr Young will go through these in a bit more detail, but I'll give an overview. So as a precaution beginning immediately, so all these plans were set in place last night. I want to thank Health and Police. People worked through the night to make sure that this was ready to go this morning. The remaining 129 guests are going to be moved to other hotels and they will be tested. They will not be charged for their time at the Grand Chancellor or in the hotels that they are going to be moved to. 226 people who worked in the hotel since December 30 are going to be contacted and they will go into quarantine and get tested. Once again, precautionary. 250 quarantine guests who have left the hotel since December 30 are now currently being contacted. They will be quarantined and they will be tested. Once again, precautionary. No more guests have gone into the hotel since the variant was discovered on January the 7th. So as you can see, everybody is cooperating, everyone is doing the right thing. The investigation is ongoing. But what we are seeing is that this UK variant is unknown. Dr Young will be briefing AHPPC, and I plan to communicate with my state and federal counterparts after this press conference as well. I think we need to immediately look at the way in which we are handling people coming into the country, international arrivals, and also to looking at the quarantine hotels that they are going into. Of course, we have to put in additional precautions, and we are doing that immediately. But what we are dealing with here is something that we've never had to deal with before. When we were dealing with the COVID, we knew what we were dealing with over a period of time. but now this is a new, highly infectious strain. We do not want to see this getting out into the community, and that's why we have taken these precautionary steps today in the interest of the public safety of those guests at the hotel and the ones that have been released. So, look, I'll hand it over to Dr. Young to go into a little bit more detail, but I thank everyone for their patience and understanding. But once again, Queenslanders, if you have any symptoms, please go out and get tested. And for those in the Greater Brisbane region, remember to look at the rules about where and when to wear your masks. Dr. Young.
Thank you, Premier. So 2 new cases overnight in Queensland, both in hotel quarantine, and of course we will be urgently doing their whole genome sequence, as we've been doing with everyone who's tested positive in hotel quarantine. And can I please thank the staff who've been involved in Queensland Health in doing genome sequencing. We are clearly leading in that area, and we are getting these results back so quickly. So yesterday at 5 a.m. in the morning, I was told that we had a positive case in a hotel, and I asked for genome sequencing to be done urgently, and that's the result that came through 10:30 last night that was confirmed. So we now have 6 cases that we know are in that cluster. So we have the original gentleman who returned from the UK on the 30th of December. So he has infected his partner, who of course was in the same room with him. That is not surprising. But he also infected a cleaner, and we're still trying to work out how that happened. There is nothing that we have been able to find so far that has linked that man with the cleaner. So the cleaner became infected and then has infected her partner. Again, not surprising. But the surprising thing now is that the gentleman and his daughter, who I notified you of yesterday, and we did that urgent genome sequencing yesterday, has clustered with the UK man. So those 6 have essentially the same genome sequence. So we know they are linked, but we don't know how they're linked in terms of spread from one person to the next. We just know that in some way it has happened, which is why I've advised the Premier this morning that I think the safest thing to do is to move all of the guests out of that hotel to other hotels immediately. So that has now started and will happen today. So all of those 129 remaining people in that hotel will move, will get tested, and will stay in quarantine for 14 days unless we find out what the link is. So far it's floor 7, so we're going to be very, very careful about floor 7, of course, and see whether that's where it's spread, and the rest of the hotel is fine, but we don't know, so we're taking a really cautious approach, as we always do here in Queensland. Then, given that the earliest there could have been any spread from that gentleman from the UK is when he arrived into Australia, into Brisbane, on the 30th of December, we're using that as our point going back to. So anyone who's been in that hotel since that time, the 30th of December onwards, whether they be staff, ADF, police or health, or any of the guests and the maritime services workers, maritime workers, we're asking that all of those people immediately get tested and go into quarantine for 14 days from when they left the hotel. So we're now, and we've started that work this morning already, we are ringing up all of those people, wherever they are in Queensland, all throughout the country, and we're asking the National Incident Room to work with anyone who's gone overseas, and Maritime Safety Queensland is working with any maritime staff who've now gone on vessels and left Australia. So we're going to do a very broad process to just go ahead, with all those people. This is what contact tracing is about, and we have the best contact details ever, of course, for this hotel. They have been fantastic. They have all these details, so we've immediately worked through the night to sort all that and have that process start first thing this morning. So it's in place. So we need to just find all those people and test them. Now, I want to thank Queenslanders because over the last few days you've come forward and got tested. So that is comforting in terms of that I suspect there aren't any chains of transmission happening out there in the community somewhere in Queensland because one of those workers has gone back somewhere. But what we need to do more, because I always want more, so fantastic result to date, but today, please, anyone in Queensland with any symptoms at all, please immediately come forward and get tested. Now, I also want to go through the venue list of people I want to come forward and get tested, even if they don't have symptoms. So that is so important. We're now up to, and I thank every one of these people, we're up to 406 close contacts of the cleaner and her partner, and 310 have already had their results back. One of those, the partner, of course, is positive. All the rest are negative. So that is fantastic. They, of course, need to have the full 14 days quarantine. So that is excellent. But I ask again, and I'm going to go through these, and of course it's up on our website and we've sent out public health alerts, but it's really important. So anyone at Woolworths, Cullen Vale North between 11 a.m. and midday on the 3rd of January. Anyone at Coles Sunnybank Hills Shopping Town between 7:30 and 8 a.m. on the 5th of January. Anyone at the Nextra Sunnybank Hills newsagent between 8 and 8:15 a.m. on the 5th of January. Then I would ask anyone, and people have already come forward, thank you very much, who has been at the Bunnings Warehouse Acacia Ridge between 2 and 2:40 p.m. on the 5th of January. Anyone who's been at the Sunnybank Cellars, Hellawell Road, Sunnybank Hills between 2:05 and 2:15 p.m. on the 6th of January, and anyone who's been in that Hotel Grand Chancellor from the 30th of January onwards. So those sites are critical. It doesn't matter whether you've got symptoms or not, please come forward. You need to be tested. If you're not sure what you need to do, ring 13 Health. You can ring them 24/7. Then I would also ask the people in Mullaney who've been fantastic coming forward to get tested. Capriccio's Italian Pizza Restaurant between 6:30 and 7 on the 6th of January. Purple Palette Cellars between 4:15 and 4:25 on the 7th of January. And Woolworths Supermarket in Mullaney between 4:30 and 4:50 on the 7th of January. So I'd ask all of those people also to come forward whether or not they've got symptoms. The rest of Queensland, please come forward if you've got any symptom, no matter how mild. That is really important. So as always, we can find the first case in a cluster, as has happened with this current cluster, the cleaner, who was superb. If we could find the first case, that's critical. If you don't have symptoms, you don't need to come forward at this stage unless a public health alert goes out. And I remind people who've come from Victoria, you only need to come forward to be tested if you've got symptoms. You don't need to come forward and get tested without symptoms, as was occurring till yesterday. Thank you.
So thank you, Queenslanders. Over the last 6 days since we announced this UK COVID case in the community, we've had over 100,000 tests. So we want to see that continue. The wonderful numbers overnight, 20,615, we want to keep our testing levels this high, if not higher. So no matter where you live or are residing or holidaying in Queensland, if you have any symptoms, please come forward and get tested so we can have the confidence that the virus is not circulating in the community. I want to thank Dr Young, Queensland Health and the Queensland Police Service for the work that they've been doing overnight to inform those people who are currently in quarantine, who are due to be released, that they will need to remain in quarantine but will be moved for identifying all of the people who have left hotel quarantine since the 30th of December at the Grand Chancellor, and also identifying all of the staff who have worked at that hotel since the 30th of December. We know who these people are, so we're not putting a general call out to the public. We know who they are, and we will be making contact with those people urgently to ask them to be tested and quarantined. What we are asking the people of Queensland is to simply come out if you have any symptoms whatsoever and get tested. That's what we need you to do, and of course comply with the directives around mandatory mask wearing and also the other restrictions, social distancing and good hygiene. So we need people to follow these practices. And of course we will be moving people from this hotel today. If anyone does have any information about potential breach at the hotel, we're happy for those to come forward on Police Link, the 131 444. But can I say this? The reason why we are undertaking these very cautious measures is that at this point in the investigation, we have not identified any actions or breaches that directly link this virus to these individuals. We know all 6 have the same virus, but we aren't able to identify at this stage what action or breach or environmental circumstances have led to that transmission, and that is why we are taking these measures. So we do want to thank the hotel, the cleaner herself, who has been interviewed since the first night that we identified she was positive, working with us. We will broaden this investigation with police. I also want to make it clear that when we talk about staff getting tested and going into quarantine, we have already quarantined all those close contact staff from the 7th. So these are additional staff that worked at the hotel because we want to take a precautionary measure and make sure that everyone is tested and quarantined who has been at the Grand Chancellor since the 30th of December. So thank you, Queensland. Keep coming out and getting tested, following those public health directives. If we all do this together, then hopefully when we get to the 22nd of December, we'll see these restrictions lifted and we're getting back to a more open economy and community, and we can enjoy Queensland as we have been doing for the last few months under less restrictions.
Good morning. So I might just give you a quick operational update of what's been happening in the last period. So we've seen police officers, since we started on Friday, issue 2,087 masks to our community. We've only seen 2 more penalty infringement notices in the last 2 days, which is fantastic because that brings it up to 24 for the total period. For 2.5–3 million people, that's pretty good. Although the vast majority of people are doing the right thing, we thank them for that. I can tell you now that we've had to issue 6 notices to appear for people for more serious offences relating to this lockdown, and there have been some instances, for example, where officers attended at Annala where a person was refusing to use a mask. Police tried to get the person to wear the mask. That person assaulted the police and was arrested for that, and also been charged with not following the chosen direction. And similarly, a report from members of the community about a person in the Queen Street Mall on the 10th who was refusing to wear a mask when getting takeaway food. When police attended, that person spat on the member of public that had been reporting it and was arrested for quite serious offences there, as well as not complying with the Chief Health Officer's direction. So that is very disappointing. The message to our community is you have the opportunity to wear the mask and comply with the directions to keep our community safe. When you're asked to do so and the police give you that opportunity, please take that. There are serious ramifications. I might quickly just say that also that our operations at the border, we've seen 3,948 domestic passengers processed in the last 24 hours and 5,562 vehicles at the road borders, and a total of 45 people refused entry to the state. On the investigation, as you have heard, we are prioritising that. These things are meticulous. They take time. Not only are we investigating the actions of any persons that were involved with the Grand Chancellor Hotel who worked there or may have been in quarantine there, we are investigating the behaviour of a virus which is new. So this is a very difficult thing to do. And of course we are being meticulous and are prioritising, but we are not rushing it. We need to understand what's happening because this is a dangerous virus, and we need to understand what those vulnerabilities are so we can prevent this sort of thing happening in the future. And that includes going through CCTV, but not all hotels, including this one, have CCTV everywhere, and in fact we don't have CCTV on that particular floor, so that means we have to be even more meticulous about how we go about our investigation, and that will be ongoing. We'll keep you advised of what's going with that. So that is our priority at the moment. And can I just finalise by saying also to the Grand Chancellor Hotel, thank you for their cooperation and their commitment to working with us to get through this. Thank you.
We're happy to take some questions.
Premier, where will the other guests, which hotel will they?
A number of hotels in the city.
Will there be a list being released? Or
Sorry?
Will there be a list of the hotels being released?
It's just whichever hotels we can put them into that have been doing quarantine. So.
Is that okay capacity-wise in your
Yes,
hotel?
yes, we've got capacity. We worked through that last night, overnight, so we're more than comfortable that it'll be operationally finalised by the end of the day.
Premier, you said you want to see how we deal with overseas arrivals to be changed. What are you proposing we do?
Well, we're learning more and more about this virus every day, and it is a completely new strain. So it is highly infectious, and I just think everybody in Australia needs to be aware that things are not as normal as they were under COVID. It's really stepped up to that next level. So I know Dr Young will be briefing AHPPC today, and following that I'd like to talk to my colleagues as well, just to reiterate that this is of concern. It is of national concern, not just to Queensland, but everywhere else. So the first good step is that the number of arrivals have been decreased, but also to its highly contagious, the fact that all of these 6 people were on the 7th floor. How did it get transmitted? Was it in the air conditioning? Was it movement? Was it picking up something? We just don't know those answers yet. The investigation will go through that. And we don't know enough about this particular strain of the virus either. So we are dealing with something that is incredibly complex. But there is no need for community concern. Everything that, and I want to commend Dr Young and the Health Minister, the police, the State Disaster Coordinator and everyone who's been working on this overnight, because we are taking these precautionary steps in the best interests of Queenslanders to keep them safe. Everybody knows that that's my main goal and my main intention is to keep Queenslanders safe. That's what keeps me up at night. That's what keeps Dr Young and the Health Minister up at night as well. So that's why we are taking these steps. That's why it's really important that if anyone is ill out there, that they go and get tested, and Queenslanders have responded. They have responded remarkably well over these last 6 days to come forward and get tested.
There are groups that are in the level 7, you said that they went in neighbouring rooms, and did they have, how close were they to one another, and did they have any days overlapping?
Well, the investigation's going to go through all of that. Okay, so let the investigation go through their steps, but we are dealing with a virus strain which is 70% more contagious. Have a look what's happening in the UK, what's happening in Ireland. I mean, this, if it gets out of control, it can have devastating consequences, right? Now, we do know that this strain is coming into Australia from overseas arrivals. They're not just coming into Queensland, it's coming to other states as well. So I think everybody needs to be on a higher alert with this particular strain.
But were both groups at the hotel at the same time? Did they have days?
There was overlapping, yes, is my understanding.
Should there be a start with CCTV on every floor then? I mean, if we're moving them to another hotel, do those hotels have CCTV?
Yes, they're checking that at the moment, yes.
So do they have, do the new
They're
hotels...
checking that, yes.
They're checking... What
They're checking whether they have CCTV.
Premier, everyone's being, you said that everyone's being moved to different hotels. Does that mean that everyone's new period of quarantine resets?
That's my understanding. Yes,
So
it is. Yes.
Every person who's currently...
I know that's going to be this is going to be very tough on these particular guests that they now have to do an additional 14 days. However, it is necessary. And like I said, I would rather take these precautionary steps than have an outbreak.
The 2 new cases today, were they from the Grand Chancellor or and were they on the 7th floor? The 2
No, they're in different hotels. Okay, different hotels. That's going to happen, but they're in completely separate hotels.
Just a question from... You mentioned that those people wouldn't have to pay for their
Correct.
quarantine. Is there any additional compensation that's being looked
No, but we will be paying for their initial period of time and then this new 14-day period. I think that's only fair and just.
Just a question from Sydney. Is the requirement still 28 days of no mystery cases for us to reopen to Greater Sydney?
Yes, that's being reviewed at the end of the month. Yeah. You sure can, Jack?
What are the PPE requirements for the cleaners who work in these hotels?
Yes, so they must wear masks and gloves and gowns, and they need to manage all of that.
And is there consistency across all the hotels
Yes.
as to what they should wear?
Yes.
And is there also a checklist as to how they should go about doing that cleaning process?
Yes, so they've all been provided training.
And when we talk about PPE, does it cover their entire face?
Yes, so they'll wear a mask. Now, if they're doing the deep cleaning, so that's a room that's had a confirmed case in it, there's even more enhanced cleaning. Yes.
And what's the difference between a deep clean and a normal hotel?
Well, a deep clean is where there's been a confirmed case, so you know there's virus in that room, so you've got to take more precautions.
Just to clarify, the guests who have left and the staff, they do quarantine at home, not in a hotel?
There will be an assessment of every single person to make sure their home is suitable. That's very important. So if there are other people in that home, it mightn't be appropriate for them to quarantine at home. But we will not charge anyone for the costs of doing that quarantine in a hotel if it's worked out that they need to quarantine in a hotel. Now, that is the Queensland process. I can't comment on what other states and territories will do until I brief them at 11 o'clock.
The Health Minister has said you know who all of these people are.
Yes.
How many people are we talking that need to go into quarantine in total?
Yeah, so there's 250 guests who've left, so quarantine guests, that includes maritime workers and travellers from overseas, and there's 226 staff. That includes ADF, police, health and hotel staff. Now, we've been working through the night to compile those lists with the hotel, and the hotel's been fantastic, and with all of our colleagues. So there might be a few more that come through, because I want to go right back to the 30th of December.
Looking then around the world at how people have responded to this UK variant, are there any suggestions around the world that, I mean, with air conditioning, for example, that this variant in particular may be more airborne or may be able to be carried through those vents? I mean, is that something you're looking at? Or?
Of course, but we don't know anything. That's what I'm saying. This is still a very recent variant, and we don't actually have a lot of the information. What we do know, it is very much more contagious. We know that. So that's what we've got to work with. At this point in time, we don't believe it causes more severe illness than the variants that we've been used to, and also that the mortality rate doesn't increase. It just increases the number of people who get it.
Dr. Young, what's your advice on how we can change the process for how we deal with overseas arrivals coming in, given the threat of this UK strain?
I'd like to talk to my colleagues about that, and I'm sure that the Premier will be speaking to her colleagues. I think it's important that we have that discussion.
Is there a consensus though among chief health officers, do you think, about how we should deal with overseas arrivals? There's rarely a consensus with premiers.
Oh, there absolutely is. And yes, there is always a consensus with the chief health officers around the country, but we've not addressed this yet. Let me go to them and tell them. I've spoken to the chief medical officer early this morning so that he's aware of this having happened. I now would like to go and speak to my colleagues around the rest of the country. So this is new information, to have 6 people linked to someone who has been in quarantine. So that's different to what we've seen before. So we have seen other instances in Australia where there's been transmission, that we haven't been able to work out exactly what's happened, but this time this has happened very quickly and we're struggling to find out how it's got out of that room. So that's why I need to speak to my colleagues.
Dr. Young, what's the process of moving these people from the Grand Chancellor to other hotels, given we don't know how it was transmitted? It seems a bit risky moving them. Will it be a police escort? What's the name?
No, ambulance will move them. So remember, ambulance have been moving positive cases out of hotel quarantine to hospitals for many, many, many months. They know exactly what they're doing. Ambulance moves infectious, potentially infectious or infectious people all day, every day. They're very good at it. So they'll be moving them.
The Premier was mentioning things like how maybe it went through the air conditioning, that sort of transmission. With other coronaviruses, things have been looked at, like the flushing of toilets as a possible spread. Is that going to those sort of things?
So we're looking at all of those, yes.
What training do the cleaners have before they start cleaning this hotel? And this may be a silly question, but are they employees of the hotel?
Yes.
Or are they contracted by
There's different cleaners. So there are cleaners that are employed by the hotel and they're provided training in infection control. Then there are cleaners that Housing and Public Works employ and they're also involved.
And why is Queensland Health, investigating itself in this instance? And what oversight does police have?
So police are the lead in the investigation, but they need help from us in terms of the infection control. They're not experts in infection control, so there are experts from Queensland Health, but the police are leading this.
Given that, Dr. Young, given that you mentioned that it's floor number 7 that is the area where the transmission has happened, if there are people on other floors who are, for example, on day 13 or even 14 of their quarantine period, they've tested negative, what's the rationale to force them into an additional 14 days?
Because I don't understand how it's happened on floor 7. So it could have happened elsewhere in the hotel. It could happen, we've seen in other states, there's been transmission from one floor, missed a floor, down to the next floor, and they haven't been able to work out how. So now that we've had 2 separate transmission events, I think we have to be very cautious and move everyone out. And until we've got better information, at this point in time, they've got to go into quarantine for 14 days. If we find out what's happened on that floor 7, and that's a reason for how it's transmitted, then that might change. But at this point in time, it's 14 days because I don't know how that transmission's occurred.
Are all the staff at the hotel also required to be in isolation?
In quarantine, yes, for 14 days from when they were last in the hotel.
Do you have any concerns that by moving these people from the Grand Chancellor to another hotel that it could move the strain to other quarantine sites?
No, I'm not, because we have not seen this happen in any other hotel, so that's what we need to do at this point in time. We need to move them from this hotel to other hotels. And remember that this hotel has been taking travellers since the end of September and done a really, really good job. There's just been this incident that we've got to try and unravel.
Really good, yeah. Thank you.
Thanks, everyone.
And,